Good evening, everybody. Welcome to the Coronavirus Update Show right here on Converge Media. My name is Omari Salisbury, as usual, joined by producer Nikki Barron. How are you today?
I'm tired.
I think not only you, me, but even the whole country is tired right now. I mean, it's been a lot.
Yeah. And when you work in the news, you don't get to just like get your tub of ice cream and hide under the covers. You kind of have to dive headfirst into it, something I'm learning.
Yeah, the news doesn't stop, and it seems like the news cycle just gets a bit faster and faster. Want to welcome you back to the Coronavirus Update Show. I know that we had skipped the episode. Small company here, a lot of production going on. But when we missed the episode of Coronavirus Update Show, we got so much feedback from people. They're like, "Where's Nikki Barron?" Nobody's like, "Where's Omari?" But they're like, "Where's Nikki Barron? Where's Nikki Barron?" So welcoming you back to your show here, to Coronavirus Update Show. I know you got a lot of stuff in store for us today.
Yeah, I do. I've got some pretty cool headlines I want to hit. I kind of want to just get caught back up, even for myself, about what's going on for us here locally and nationally. So
All right. Well, as usual, we always start this show with the numbers. So let's get right into it.
let's do it. All right. So another 2,892 coronavirus cases and 49 deaths have been reported in Washington, bringing the total number of diagnoses to 269,201, including 3,838 deaths. Oh, wait, my number, 3,482 deaths, according to the State Department of Health. We have at least 15,160 hospitalizations due to the coronavirus. And we're seeing a little bit of a delay here on this data because we're just kind of in the thick of it. So these numbers will definitely fluctuate over the next couple of days as we get caught up. For the past few weeks, we've been hovering between 80% and 87% ICU capacity, with today settling in at about 84. And then our positivity rate for the past 2 weeks or so has ranged everywhere from 10% to 17%, with today being 17%. So we're kind of at the top end of that today. And our goal for that is to get to that 2% positivity rate. Nationally, in the U.S., with more than 22 million cases reported to date, including more than 375,000 deaths, we broke yet another daily death record in the U.S., and we logged 4,406 lost lives yesterday. And yeah, I mean,
For 4,406 deaths yesterday.
yeah.
Wow.
I mean, and it's only going to get really worse from here. I mean, as more aggressive strains of the virus, like the ones from the UK and South Africa, are getting discovered across the country, it's going to make everyday living a lot more dangerous. It's going to make having a 17% positivity rate mean a lot more. It's going to make stuff like traveling, eating out, gathering in groups even more dangerous than it even is now. And we just found yet another new strain in Ohio.
So when you say these strains or variations is another word that people are using, real quick, does that mean? I mean, it's still the kind of the same coronavirus, but it just has some, I guess, literally some different variations. I know one they talked about was it wasn't so much that it was more deadly, but more contagious, which ultimately means that a higher number of people might get infected.
Yeah, exactly. So far, all of the variations on the strain are not any more deadly. They're just more infectious. And that makes sense with the way that viruses mutate. They mutate and create these variations to try to reach as many people as they can. And it seems sort of like this 1.5, a little under 2% death rate is a comfortable place for the coronavirus. They're comfortable with that. They feel like they can spread. And so that's kind of the goal of the virus, is to get into as many people as they can and continue to replicate and continue to live. Its goal is actually not to kill us, because then it wouldn't be able to spread. So with this lower, definitely not low, death rate, I mean, it makes sense for the virus to mutate in this way, to be more contagious, but not necessarily more deadly. I
Man,
really
that's
had to
a
pull out that biology, like college biology, like
man, that's a lot. So I know that some big news is that the federal government they made a change in their policy regarding the vaccine and how the doses are going to roll out.
Yeah, so here's a story from the Seattle Times. And so today, the federal government caught state and local governments off guard by holding a press release with the new COVID-19 vaccination recommendations. And essentially, they didn't give any notice to any local governments that they were going to change what they were saying. And so Mike Folk, an Inslee spokesperson, said the governor's office learned of the federal changes through the same news report that everybody else did. And they actually still haven't received anything in writing about the new eligibility policy. So essentially, yeah, they just sort of dropped that bomb.
Well, I mean, but is this a good change of policy from the federal? I mean, even though it might be sudden and unexpected, is this a more welcome change in policy what the federal government's talking about?
So people believe that this statement was dropped as a way to try to gain favor after everything that's been happening with the Capitol riots. As we know, Trump was impeached for the second time today. And so basically what this new federal guideline said was that anyone 65 and older, or who was a frontline worker or had health risks that put them at risk to have a worse outcome with COVID should get in line to do the vaccine. So essentially it made it so that more people would be eligible under the guidelines. And so that's a little different than what we have here in Washington. And the thing to note is that just because the federal government set this guideline, it doesn't necessarily mean that the states have to listen to it. And when they asked Governor Inslee's spokesperson about it, he said he would take it under advisement. But at this point, there's no changes to the way that they're actually going to roll out the vaccines.
Well, speaking of Governor Inslee in the state of Washington here, how does the state of Washington's plan for vaccine rollout now compared to what the federal government is talking about?
Yeah, so I actually made a little handy chart here so we can go through it together because I'm very visual. So, so Washington is currently working through the end of phase A2, which I didn't put here on the chart because we're almost through January already, which is pretty wild. And A2 just includes all high-risk first responders and healthcare workers. So we're currently moving into phase B1, and we saw an announcement from the mayor of Seattle about how they are actually going to be jumping in and helping the state government and county government with this phase. So in phase B1, that includes all people 70 and older, as well as people that are 50 years and older who live in multi-generational households. And they're prioritizing people who live in like adult care facilities. So that's kind of where we're sitting right now with B1. That's kind of where everyone is the most familiar with what's going on. Phase B2 is set to begin in February, which includes high-risk critical workers 50 years and older who work in certain settings, which includes agriculture, food processing, schools, childcare, corrections, prisons, jails, and detention centers, as well as public transit, fire, and law enforcement. Phase 3, or B3, is set to begin in March and includes people 16 and older with 2 or more comorbidities, which are basically 2 underlying conditions, like if you have diabetes and asthma or, things like that. Mm-hmm. April's the beginning of our B4 phase, which will vaccinate high-risk critical workers under 50 who work in those same settings that we saw in the B2 phase, so agriculture, food processing, grocery stores, K through 12 staff, childcare, corrections, public transit, fire, and law enforcement. And they really haven't given us much information about what comes after that. So based on this current rollout plan, most of the general public are not going to see an opportunity to get a vaccine until the summer.
Wow. Now, I know that not only here in Washington State, across the country, there's people push to get people back in school or get kids back in school and things like that. A big part of that is actually vaccinating teachers, and we're different parts of the state. We hear teachers lobbying for, to be higher on the vaccination line. I believe in your chart there they had in February. But what are teachers saying about vaccination?
Yeah, so in an article from the Seattle Times, this is a statement that they released. So, for many employees, by the time they are fully vaccinated and gain full protection from the virus, school districts across Washington will be nearing the end of the school year. This is unacceptable, wrote the group, which includes the Democratic chairs of the state Senate and House Education Committees, Senator Lisa Wellman, Representative Sharon Tomiko Santos, and the Republican ranking members, Senator Brad Hawkins and Representative Alex Ibarra. And essentially what they're saying is like, yeah, we're trying to get back to our kids back to school. And even though kids seem to have lower transmission rates and lower morbidities, like it's like if we prioritize teachers, we're going to get back to normal a lot faster when it comes to childcare, which we know predominantly affects women who have had to leave the workforce to homeschool their kids. So it
Right.
can help a lot.
And I know that the governor. I mean, this stuff is hard to keep up with.
Yeah.
And I don't know if they're intentionally making it hard to keep up with. The governor came out with a map and some other stuff that I'm sure you'll get to. But like, what are some of the what is the state's best advice right now when you talk about like safety and what people should be doing?
Yeah, so we've got a new plan that just came out. It feels like eternity, but I think it was last week. And it is Governor Inslee's Healthy Washington Roadmap to Recovery. So I have this chart here. It's pretty small, so I'm going to try to break it down for you guys, kind of talk about where we're at with that. So, in a press conference recently, Governor Jay Inslee announced his new path forward for reopening called his Healthy Washington Roadmap to Recovery. And as of yesterday, or the 11th, so that was 2 days ago, we are now officially in phase one. So, regions in phase one, which is currently all the regions, we're all starting out in the same place. So, kind of what we can and can't do is we cannot gather indoors with people who are not in our households, but we can gather outdoors with up to 10 people and a limit of 2 households. Worship services may resume with a 25% capacity, and retail stores also have a 25% capacity, but they are encouraging retail stores to set up a curbside pickup system. Offices and other professional services are also encouraging remote work, but if they do begin in office work days, they are also set to that 25% capacity. Eating and drinking establishments will continue to only be allowed outdoor dining with groups of no more than 6, and they are encouraging restaurants to prioritize takeaway. Weddings and funerals are limited to 30 people if they are outdoors. There are still no indoor receptions or services. Low-risk sports are allowed with up to 5 people, and all appointment-based fitness can occur with a maximum of 25% capacity. They also have some different regulations around the size of the gym as well. That's based on square footage. And then private rentals of indoor entertainment establishments are allowed for individual households up to 6 people. So think like roller rink, bowling alley, that kind of stuff. And then outdoor is allowed for groups up to 10 with a limit of 2 households. So I think the biggest difference we're going to see in this plan compared to previous plans is that the Healthy Washington is moving through phases in regions rather than counties. And
Yeah,
there's
they came out with a new map or something, right?
Yeah, and it's a really interesting. So there's 8 counties, or not counties, but regions, and they're not based on counties. So they're actually being based on the health systems and the resources that are available. And the reason that they chose to do it this way is because when they're trying to make decisions about phases, they're looking at a couple of different things, the different numbers to try to see kind of what's safe. And one of those numbers is hospital capacity. And so I think they were really grouping things based on that. So where if we do see a rise, are we going to have the health systems there to accommodate that?
Man, lots of changes. I'm glad. I'm glad you're staying on top of that map. You know what I'm saying? It's this is interesting. Is the governor given any other direct advice or direct? We get a lot of stuff coming out of Olympia.
Yeah, so there's not really any direct advice outside of what you see here. He's actually telling people that although you can do these things, it doesn't necessarily mean you should do these things. And that makes sense, because there is always going to be risk when you leave your house, when it comes to COVID. So all of these different phases, they're not saying like, oh, this is a 100% risk-free thing to be outdoors eating it, at a restaurant, but it is a much, much lower risk than eating indoors with the way that we're currently spreading the virus in our communities. So if you do have, health, worries, or you do feel that you might get you might get an aggressive form of the virus, or that you might, spread the virus in your community if you catch it and you're asymptomatic. I mean, you don't necessarily have to do these things that are in the phases. It's kind of what I'm getting at.
Right. And I know something else that made big news here is, especially when you talked about these other strains and variations and ones that are in other countries, is travel restrictions coming into the United States.
Yeah, so another article from the Seattle Times, and it says federal officials will require all international travelers flying to the United States to show proof that they have tested negative for the coronavirus, Centers for Disease Control and Prevention officials announced on Tuesday. And really, I mean, we haven't actually seen a ton of federal restrictions or guidelines when it comes to safety measures around the pandemic. We saw early on some travel bans from, places like China, and currently we're seeing travel bans from places like, not even full travel bans, but partial travel bans from places like the UK and South Africa, where we're seeing these more aggressive strains. But really, this is kind of the biggest federal safety measure I've seen them put in place that I can think of, unless you can think of another one. Oh, you're muted.
That well, is it something as well like they have to have a test before they enter? They have to be tested. The test needs to be verified. Some everything else. I think it may just be me, but this is going to be the start pretty soon of a vaccine passport that depending on how this COVID thing rolls out, to where it's like you're going to have proof of whatever to really move around the world.
Yeah.
And for me, I spent a good portion of my career working across the continent of Africa and the Middle East. And in a sense, not in such a formal way, but in a sense, the yellow fever card. There was a lot of countries where it was a bit different though with the yellow fever, because if somehow you did land and you didn't have a yellow fever card, there was an infirmary there in the airport and you get the shot when you landed. But it was a lot of countries where they could actually deny you entry if you didn't have a yellow fever card. But I see this in the future might be on a whole another level, to where you have this vaccine passport, man. If you don't have the vaccine, then, or you haven't been vaccinated, then you probably won't even be able to take off or board the aircraft.
Yeah, no, definitely. I could see that for sure. And I think that would be really odd for Americans, because I forget the statistic, but it's some like crazy number, like 90% of Americans don't even have passports. Like, I don't know the passport statistic, but I'm going to look it up really quick.
I can tell you this though too, that little blue book, that little itty bitty blue book, we're used to we can land almost anywhere in the world. You can really put countries that people really want to travel to that require visa before departure is a very small list. Yeah. You get on the plane with your American passport and go to almost anywhere. I think there's only one or two countries in the whole continent of Africa. I think Nigeria, you need a passport prior. Almost anywhere else, you can basically get on arrival. Most countries in the Middle East, throughout Europe. And so, there's always been a lot of flexibility for Americans, where people from other countries, a lot of times they need a visa prior to even taking off. And so it's a luxury that we've always had here as U.S. citizens, passport holders, is just hop on the plane and go. So yeah. It's also going to be interesting for people who used to travel a lot or want to get back to traveling a lot. And, if it's going to be a requirement that a country won't admit you if you have not been vaccinated.
Yeah. So I actually pulled up that passport number. So it says that We have just hit a record high of passport holders in America, 42%. But in 1990, only 4% of Americans actually had a passport. So I think a lot of people are going to find that these requirements that you get going into other countries, which seem very normal if you're an international traveler, I think we're going to start seeing that here. I think that we could easily see a vaccination card being a requirement to come into the United States.
Right, and with boosted passports as well is then when Mexico and Canada required a passport for you to be able to get. You didn't used to have a passport to go to Mexico or Canada.
Yeah, I remember going to Mexico as a kid, and I didn't have a passport. Yeah, but kind of like what you're saying, like in Mexico, there's actually like a certain amount of money that you have to show that you have in your account before you can like even leave the country. So there's a lot of requirements that or to come to America. So there's a lot of requirements that I think Americans are going to get their first taste of.
Yeah, unfortunately. Hey, we're going to take a quick break right now. When we come back, we're talking about a kind of icky, sticky situation that the University of Washington is doing right now in a way to be able to track COVID. You're watching the Coronavirus Update Show. All right, welcome back, Coronavirus Update Show. My name is Omari, Salisbury, joined by producer Nikki, Barron. And before we took that quick break there, you're going to tell us more about it, but it turns out people are testing sewage to try to get a better understanding of the COVID spread.
So, as Reverend Walden says, you shouldn't leave people in an affected state. So I wanted to highlight a positive story that I found, and I had to dig pretty deep to get it. But yes, the University of Washington has begun a program to test our wastewater to detect COVID-19. And they actually made a really great explainer video. So I'll play that for you guys here because I think we'll let the scientists tell you a little more about it.
All right.
As you know, there's a big coronavirus pandemic. And one of the big things that kind of limits how we can address the virus is who has the virus. When someone has coronavirus, some of the virus is shed in their feces. So what we're trying to do is kind of use wastewater to quantify how many people in a community have coronavirus. So what we're doing up here at the manhole is we're sampling probably between 20 and 50 houses just up the hill here.
As the outbreak was kind of ramping up in the Greek system, we thought this would be a really good spot just to see if we could detect COVID or see a trend as COVID changes in this area.
And so we're collecting kind of downstream from those houses the wastewater and hoping that we can kind of monitor one of the biggest outbreaks in at least the city of Seattle. This pump station collects wastewater from the University Village as well as just north of here. And so right now we have an auto sampler set up, so we're able to collect samples 7 days a week, 24 hours a day. And then we take that back to the lab and look for coronavirus. I think wastewater is exciting. It's a little bit gross, but it's really useful. Most of the solids you see are just toilet paper. Really what we want is the feces to be able to get the coronavirus, but they dissolve pretty quickly. This is the raw wastewater sample, and I just mix it up you can see there's like a little bit of suspended or like settled solids there. Let's see, so this was run on the 3rd. So basically every red box means the sample is negative, and the green boxes mean the sample tested positive for coronavirus.
Geosampling can allow us to check in individual neighborhoods where's the fire burning. So it is kind of a smoke detector to show where is an upgoing trend and where are things actually okay. That is a lot cheaper than testing all these individuals in these different areas, and allows us to monitor with just one sample all these different communities to see where is an upward trend, where is a downward trend.
Yeah, I'd be lying if I didn't say I was laughing through that one. And I was thinking, right? When I was in college, I worked in an environmental research lab in northeastern North Carolina, and it was the Dismal Swamp. And we used to think it was a bad job to have to go all the way into the swamp and try to get this swamp water and see what was going on. But compared to what these guys are going and getting samples of, whew.
Yeah, and I like your mom's comment. That's what, like, I was like hanging in there, like not laughing, like this is science, and then like your mom's comment, like COVID-19 in BM. I was like, I can't. It's coming out. But yeah, essentially, this is an early detection system. So this will actually allow local officials to catch COVID-19 hotspots faster. So. So kind of the way that it works is, they can detect the viruses in a neighborhood sewer system. Then they can start notify everybody in that neighborhood, start doing mass testing, really aggressive contact tracing, and getting people to isolate and, potentially getting them into early treatments. So try to kind of cut it off at the knees, and we actually saw this work recently. So there was an outbreak brewing at a juvenile detention center in Las Cruces, New Mexico, and because they had implemented this testing, they were actually able to catch that before it spread throughout the juvenile jail. And then some of the guards and everything also worked at other juvenile centers in the area. So they actually stopped it from spreading to other locations, because I actually found 2 of the guards tested positive and were asymptomatic, and they worked at multiple locations. So using this system, albeit a really kind of gross system, they were able to probably save a lot of lives and stop the spread. So it's a gross positive.
I'm gonna leave that with you.
Hey, as the children's book says, everybody poops, and that poop will save us from COVID
outbreaks. Well, you definitely didn't leave us in the affected state today. You're actually leaving us with a smile. And man, this is it for Coronavirus Update Show for this week. You're back again on Monday at 6:15.
Yes.
Bringing the numbers, bringing the news. I'm sure you'll have a very charming guest by then. We got a few days to figure that out. But also, you're back tomorrow morning at 11 a.m. on the Morning Update Show. Before we get out of here, though, Nikki, Barron, how can people get more information and resources online?
Yeah, so you can head to our website at whereweconverge.com, navigate over to that COVID-19 tab you'll see at the top, and that's where you'll find all the past episodes that you see here. You'll see links to important dashboards and databases that will keep you up to date on all the numbers, and you can also find a link to the podcast version of the show that gets put up every evening right after we get off the air. I popped that up there, so if you guys want to share that, you can. But yeah, so whereweconverge.com, and then find the COVID-19 tab.
All right. Well, we're getting ready to get out of here. Again, you catch us tomorrow morning at 11 a.m. at the Morning Update Show. But for the Coronavirus Update Show, we're gone. Everybody poops.